Okay, so again, it's a pretty quick overview. Just gonna learn some husbandry basics, things that you wanna make sure that we're considering. If you have sheep and goats, if you don't and you're just interested, this is a great place to start. Herd health programs and why they're important, some common diseases, and I'll give a couple of examples, and then some vaccine programs and records. And then we'll jump over to Julie's presentation. Okay, so goats versus sheep. Goats, their genus is Capra, sheep are Ovis. Caprine are goats, ovine are sheep. They've both domesticated over 800 or 8,500 years ago, and they both have many different domestic breeds. So there's dairy goats, meat goats, dwarf and pygmy goats, and fiber goats. As well, there's fiber or fine wool sheep. There are predominantly meat breed sheep. There are dairy sheep, which not a lot of people knew. And then there's also hair sheep, which again are predominantly meat breed sheep. But the nice thing about them is they don't have to be shorn. So a lot of different breeds and types that one might consider. So if you just want a sheep or goat because you enjoy them, there's a lot of different personalities, even within types of animals, so dairy types and things like that. So there's a lot to consider, and certainly if you don't have sheep and goats, those are some very first questions to ask. What are some differences? Goats tend to be browsers, which means they're more like pruning shears. They really like going after shrubs. They will still graze, but they do really enjoy browsing shrubs and trees and things like that. Sheep are typically more grazers, so more like lawn mowers. Again, they will browse a little bit, and especially if they've learned that some of these plants are really yummy, they may, but we typically see those kind of feeding behaviors as differences between the two. Goats tend to form social cliques or family groups. So if goats grew up together, they tend to stay together, and they form a really strong hierarchy. And moving them within or between groups can really disrupt that hierarchy, and you can see quite a bit of fighting in goats. So that's something to consider. And then sheep tend to be more flock-like, or have more flock-like behaviors. So, which is really important when we're moving them. They don't tend to fight as much as goats do, potentially. But then even within sheep, there are certain breeds that maybe flock a little bit less than others. And then, gosh, I was just thinking of something that was really important with it. But either way, what I was going to say is they're both herd animals. So it is important, if we're considering having sheep or goats, to make sure that we have at least two, because they are both they like to have a buddy. As far as housing goes, they can be kept in permanent fencing or temporary fencing if we're moving them kind of around a property. I've seen folks with small acres do that really well with temporary portable fencing like electronetting. There's some benefits to that. There's certainly benefits to permanent fencing. It's definitely less labor. They tend to maybe have a little bit more thoughtful design about how those are put in. The challenge with permanent fencing that's already on premises is that they tend to have wide gaps in them, and especially with goats, that can pose some issues because they can be a bit of escape artists. They also really like to, I think I have a photo in another, they do like to stick their head through fences. And so we do recommend, if we're kind of trying to close those gaps to keep them in, to use a fencing that has narrower holes, so like no climb fencing, so that they can't get their heads through as well. It is important to provide shelter for them for inclement weather. It helps them kind of have regular water intake if their water is within this shelter. You can imagine if they have to go out in the rain to get to water, that they're probably not going to do that when it's really stormy. And we'll talk a little bit about why water is so important in the next slide. Natural shelter is okay if it's, pretty substantial. It really depends on how windy and how, so natural shelter would be like trees or topography, so hillsides and things like that. On smaller acreage, that might be a little bit challenging to suffice for these guys, but sometimes that can work pretty well. So, and then I have here a night pen. So that would be a place that you can keep animals at night so that they can bed down and be protected from predators. Some folks have really great success with livestock guardian dogs, even with small herds and flocks. So that's something to consider as well. I have a photo of a feed manger with goats sitting inside. This is a common occurrence and quite a big problem. And if you can invent a feed manger that goats cannot get into, you may not be rich, but you will probably be famous. So you can imagine when they're up there, they're probably defecating in it, and it's not a great practice for hygiene and disease control. But man, they just like to get in and onto everything. So nutrition is a really important thing that we want to consider for our sheep and goats, both. I have a picture of a goat here. But first of all, we'll talk about how both sheep and goats are ruminants, which means that they have this big stomach on the left side. And this picture actually shows it being pretty small. If your animal's rumen was this big, I would be a little bit concerned it wasn't eating well. So that rumen really takes up the whole left side of their abdomen if they're not pregnant. And so they can really, their job is to consume forage, which is grass and hay and things like that, and things that we can't easily digest. All the bacteria in their rumen are able to digest that and make what's called volatile fatty acids that the ruminant can now use for energy. So what's really important in their nutrition is that it has enough energy to supply these microbes and enough protein that these microbes can use. Micronutrients are also important. So oftentimes we talk about having a salt block out there, but we want to make sure it is specific for sheep or goats. If you have them together, you would probably use a sheep mineral. And then if you have any, let's say copper, for example, is the one we tend to be most concerned about. Sheep are pretty sensitive to constant levels of copper, let's say. So they do need a supplement specific to sheep so that they don't get really high levels of copper in their diet. Now, goats do need a higher level of copper in their diet. So if you did have sheep and goats together, you'd probably provide a sheep mineral and then potentially bolus copper to your goats if, at once a year, if they needed that boost of copper. Calcium and phosphorus are also an important couple of minerals that we want to make sure are in the right ratio. The challenge with this is if we're feeding a forage, so a hay, and maybe some kind of supplement, depending on if they're growing animals or if they're heavily pregnant animals, maybe we need to supplement that forage with a higher energy feed. We need to consider the calcium and phosphorus amount in both of those feeds. And we want it to be about a 2-to-1 ratio. And the reason for this is that small ruminants are especially males, are very prone to urinary stones. So let's say we're growing young wethers, whether it's for a project or maybe we're selling them as pets because they're Nigerian dwarfs and everybody loves them. We want to make sure that we've got these two minerals at the right ratio to try to avoid the two types of stones that will occur if one's too high or the other. So it's not like, oh, we can err on one side because then we'll be good. They really have to be in balance because we can get, if our calcium's too high, we'll get calcium carbonate stones. If our phosphorus is too high, we can get struvite stones. So it's a constant kind of balance there. Another thing is proper feed bunk management is really critical. oh, let's see, I did have these pictures, sorry. This is what happens with copper toxicity. So this is a jaundiced eye. You'll see that with copper toxicity. All right. Proper feed bunk management is really important, just because like I said, with goats especially, they can fight, especially at feeding time. So making sure that they have enough space between them will ensure that they're all getting enough feed. This is especially important for pregnant animals and growing animals because they really need all of the nutrition that you're getting them. And if they don't have the right feed bunk space or shape, you may see a little bit of uneven growth in them if they're young animals, or you may have some animals that are more prone to certain diseases because they're not getting the right nutrition that they get, especially if they're pregnant. What about pasture? Can we raise these guys just on pasture alone? And that is a challenging question. It totally depends on if you're irrigating pasture. What's in your pasture? Is there enough protein in the forage that's out there? And these guys are super great at answering questions about those. One kind of rule of thumb is it takes about 2 to 3 acres to feed an adult goat or sheep for a year. And that's without feeding hay or anything. And that's without them being pregnant or lactating or anything. So you can see it takes quite a bit of land, and that is also assuming that there's always forage out there that's good quality. So it can be challenging to raise animals just on pasture alone. And so often, especially with small acreages, we do end up supplementing at certain periods of the year or life stages of the animal. Water is a critical component to nutrition. These guys really need clean, fresh water. And that was the point I made with the water being close to the shelter. It's really important to prevent urinary stones, that they have adequate water intake, super important in hot weather. Goats are really actually pretty impressive. They're really good at retaining water, which is probably why they're so much more prone to urinary stones than other species. But that said, they still do need adequate water on a daily basis, especially if they're lactating, really important. All right, so how can we make sure that they're getting the right nutrition? One is to ask your advisors or your veterinarian ahead of time how much, your specific animal for its job, what's a good diet for it. That's a great place to start. As you go, though, you'll find that there's going to be some differences, and a really great way to monitor if your nutrition is doing its job is to look at their body condition. So we usually measure this on a scale from 1 to 5, and healthy animals are typically between 2.5 to 4. That said, these animals can fluctuate a little bit, especially if they have a job. So the pictures on the right are 2 bucks, and the one on the top just came out of rut. So you can tell he's a little bit leaner, and that's because he's been working. And that is normal for him. They'll expect him to gain some flesh or put on some fat a little bit after within a couple of months, so that he has really good condition like this buck on the bottom before he goes back to work again. There are a lot of resources on how to body condition score. This is for sheep. We typically do this just over that loin region, so which is right behind the ribs to right in front of the hip bones. And you're kind of feeling over the top line. So these pictures is if you were to cut through that portion of the body, what you would see or what you would feel. So you can see the one on the top is a score of 1. So this is lowest body condition, to a score of 5, which is high. And honestly, you can see animals that are kind of over fat that have a little dimple on the top. We don't want them over fat, so 5 or beyond, just because they can have metabolic issues with that. They can have difficulties with walking around, so arthritis in animals that aren't breeding. In animals that are breeding, we can definitely have problems with giving birth, and then even leading up to giving birth, they can have metabolic challenges with just too much fat. In goats, we will also look at their sternum and then their rib cage on the sides and take all of those areas into consideration, because especially dairy goats tend to be a little bit lean looking, so it can be a bit challenging to see what their conditioning is. All right, so herd health basics. Your veterinarian can really help you ahead of time to kind of understand what sort of things we need to be recognizing and when maybe we need to treat certain diseases before these issues come to play. They might be able to help you, warn you about what some of the most common conditions are. And then they can also help confirm that these diseases are taking place if they do, and then help submit samples to actually determine the actual cause, which can help inform practices that might prevent them again in the future. So they can help you design husbandry and management practices again to prevent disease, but also they can help you design an annual management calendar just to help you, as you can imagine, if you're in a production cycle, so let's say you want to do a small farm for your family, keeping that cycle going is a yearly process, and making sure that you're planning it ahead of time is really important so that you don't get behind, so that you're being more proactive than reactive, which if you've ever experienced the lambing or kidding season, it gets really intense. So it's really good to have a lot of these things planned out ahead of time. So this is a production calendar that I kind of just sketched out really quickly for one of our friends. It identifies some of these windows of opportunity. So let's say your animals might be pretty easy to gather, but we don't want to do that any more than we have to. So we're going to design a program around what we know we need to do, and then make sure we're fitting the things in there. So we have these windows of opportunity that align with, so let's say we've bred in October. We know we want to ultrasound in November, so 30 to 45 days, so 45 days after breeding. We are lambing in February. We know we need to gather, get a hold of them so we can do all of our lambing procedures. And then we're weaning, so that's another time where we're going to gather them all, and we know that we can look at the health of our ewes and kind of vaccinate lambs and take care of some of these health practices at these core times. And so it really kind of helps you say, okay, this is when I need to call the vet out, and we're going to do that far ahead of time for these kind of management practices. So these types of things can be really helpful. It also kind of identifies when you should be keeping some records. So this will come up again later, but these are the good times where we're going to write things down. And then when we meet again at another time, we can evaluate what our numbers were from these periods. So vaccinations are going to be something you're going to talk about with your veterinarian. The only core vaccine that we really have for sheep and goats is CD&T. It's a clostridial vaccine. It protects against Clostridium perfringens type C and D, which is it's a intestinal bacteria, and then also Clostridium tetani, which causes tetanus. Super preventable diseases. The vaccine is very effective. It's a must-give vaccine. It requires 2 shots for its first dose, and then every year is an annual booster. Hoof care. Goats require pretty frequent hoof care. They have really tough hooves. If you've ever been to Hawaii or other places where these goats are climbing cliffs, I mean, their hooves are meant for rocks, and we typically don't keep them on rocky surfaces, so their hooves don't grind down on their own. So they do need to be trimmed every 4 to 6 months, depending on their footing. Sheep, we can typically get away with once a year. Their hooves aren't as hardy as goats are. That said, some may need it more than others. It really just depends. But hoof care is really important for good movement of the animal. Making sure we're paying attention to body condition score again, and then making sure we are attentive to good parasite management. That could be doing a FOMACHA or 5-point check every time we've got these guys in for vaccine appointments, or anytime we have them in. These are some things that we want to pay attention to. And then planning shearing and clipping for either our wool type breeds or are goats that, even goats that aren't fiber goats can get a lot of that under cashmere kind of things. And if it's not shedding well, it needs to be removed so that they can tolerate the summer heat better. So these are things to plan as well. For breeding animals, there are some other vaccines that we can consider that can help depending on just their risk. So other vaccines that we'll include, we would just talk about as far as kind of a risk-based scenario. So if they have, if maybe they've experienced abortions or the place where you're getting them from have, that, there are some vaccines we can give before breeding to minimize that. If you are breeding, right, 4 to 6 weeks before lambing or kidding is the time to give your CD&T booster to your adults. That makes sure that those antibodies are in their colostrum before they have their babies. Breeding soundness exams are a great thing to do for females even. So you want to make sure they have a good healthy udder that can support babies. You want to make sure that they're a good size and an appropriate size for the male that you're choosing. If you are keeping rams or bucks, it's always a great idea to do a breeding soundness exam on them. If you're not, artificial insemination is a great thing to talk about with your veterinarian and how to breed your females without having to bring a male from another herd on site. It kind of helps with keeping diseases off your farm if you can. Pregnancy diagnosis is a great way to just know what's coming in the next 5 months, and kind of helps you plan ahead. Remembering that for females that are lactating, so dairy goats, dairy sheep, it's a really good idea for them to have a 60-day dry period. It's really important for udder health. So doing a pregnancy exam can help you age that fetus and plan. So let's say you didn't do artificial insemination and you just had the buck out there for a number of days, maybe a month or two. You may want to do a pregnancy exam so that you can age that fetus and plan when her dry date should be. Again, crutching or shearing before lambing is a great idea to clean up her back end and make sure that that lamb can find the udder when it hits the ground. And then making sure that you have a plan for lambing and kidding. Like we said, it's a really exciting time, but it can be pretty intense. So what to do if maybe she's not progressing like she should, when to call, those sort of things can be worked out with your veterinarian ahead of time. Lambs and kids all need colostrum, and especially in small flocks and herds, it's a great idea to either tube them with colostrum or know how to make sure that they got colostrum within 12 hours. And either that's not just seeing them nurse, because sometimes they look like they're nursing, and they even do with lambs a little tail spin, but sometimes they're trying really hard and they haven't figured it out. So learning how to feel that belly and make sure it is full within 12 hours is really important. And then if you want to make sure that they all get the right amount of colostrum, so it's an ounce per pound of body weight, then have your vet teach you how to tube feed them. It's a really important skill if we have weak lambs or kids. That's how we'll make sure that they get nutrition while they're getting through what they're dealing with. Deciding if you're going to dam raise, so if they're going to nurse off of mom, or if you're going to bottle raise ahead of time, or if you have to bottle raise, what are you going to do? Where are you going to get that milk replacer from? Are you going to milk someone else out? So having these things planned out ahead of time is a good idea. Vaccinations. So like we said, we want our CD&T done with the females or with your adults, so your does or your ewes, before they start lambing and kidding, so those antibodies are in her colostrum. So we don't need to vaccinate these guys right away, because those maternal antibodies will interfere with the immunity that they can get from that vaccine. So we're going to wait about 4 weeks of life, so 4 to 6 weeks old is when they're going to get their first vaccine of CD&T. And then again, 3 to 4 weeks after that, they'll get their booster. Common health procedures we do to prevent problems in the future or help with our management is some way of identifying the animal So you might tag them with an ear tag. You might mark them with like paint, like a paint brand or a spray paint, and identify, if you have multiples, identify them as a litter or twins, and somehow make sure that you can identify whose mom is theirs. So a lot of times we're tattooing babies at this stage for registries. We're disbudding within a week of age, tail docking, and castrating as well. All right. How to spot trouble. So really important to see your animals every day. You learn your animal's behavior. You begin to understand their little social status quirks, what their hierarchy is. An example, so if you have a doe that tends to be the boss, if she's getting picked on, that's probably because she doesn't feel good and the other girls know. And so now they're trying to kind of take her status as top goat. So that's something that might trigger a warning. Oh, something's not right with her. This is not normal. I'm going to bring her in and see, what I think is up. Did she eat today? Is she, walking fine? So some things, if you think something is off, some of the things that your vet might ask you when you call is, are they ruminating normally? So are they chewing their cud? Do you see that left flank? We said the rumen's on the left side going in and out like it should normally. And it does that about 1 to 2 times a minute. It's kind of fun watching it roll in like an ocean. Are they pooping and peeing normally? Does it look normal? Is it the right consistency? Is it they poop little pellets? Is it that? Do they have diarrhea? Is their pee really dark? Are they able to pee? Do they have any unusual wounds or swelling? And then what is their temperature? So we take their temperature with a rectal thermometer, which is really just any thermometer you get from a drugstore, but it goes in the rectum. And that's the best way to get their core body temperature. And honestly, we miss more just by not looking than we do by not knowing. So really, again, looking at your animals every day is the best way to be able to get to a problem faster than just knowing everything that's out there. So. All right, some common diseases. Okay, we have very different routes of transmission for a lot of our contagious diseases. So there's a list on Iowa State's website of all these diseases and how they're transmitted, and it's really nerdy, but it's really great for knowing how you control these diseases. So what is the risk of getting these diseases, and how would you prevent them from coming on farm? So we call this biosecurity, preventing diseases from coming on farm and preventing diseases that we may have on farm from leaving our farm. One way to do that is by screening new additions for diseases that we can test for. We don't test for all diseases. I'll talk about the main ones that we test for in sheep and goats. Having isolation pens or a place that you can put a sick goat. Or sheep. You don't necessarily want your sick animals with the rest of the herd in case it is a contagious disease. So you want a place where you can separate them. Having good hygiene and sanitation, and then potentially, depending on how many animals you have, good traffic control. So let's say you're doing your morning rounds. You're probably going to look at your brand new babies before you go look at your 14-year-old goat, because your babies are, they have the brand new immune system. They are the most susceptible to disease, and your adult has seen it all and they have it all. So we're going to want to make sure that we don't bring diseases from our older girls to our brand new babies. All right, there are some rules for cleaning and disinfecting. 80% of this job is the cleaning part. So you're going to completely dry clean, remove dirt and debris. This could be true for pens. This is really important for trailers, especially if you're going to shows. You're going to use a soap, rinse it, and dry it. Then you'll use a disinfectant by the labeled directions. Sheep and goats do have diseases that can be transmitted to people. So it's important to know, especially, even if you're not, so a lot of them are around kidding and lambing time. In that placenta, there are a couple of bacteria that can make us sick as well. So really important to know that if you are breeding animals and how to protect yourself. So gloves, the N95 mask will protect us from Q fever, which can certainly occur in California. We're very used to N95 masks now, so we all have them. But even young kids and lambs can give us a couple of diseases, which I'll talk about. So I don't talk about ringworm, but ringworm is one that we can certainly get from them as well. Okay, so first I'm going to go over a couple of examples. I'm trying not to take all of the time. I'm going to talk super fast. But a couple of examples of the diseases that we test for. So caseous lymphadenitis is CL. All of these diseases really don't show signs until they're at least 2 years old. And if they're showing signs as a 2-year-old, it means that they had a really heavy exposure when they were a baby. So a lot of them may not even show signs until they're 4 and 6 years old. The problem with these diseases is they are not curable and they really impact their health. And these guys can live 14, 15 years. So you imagine if they're showing signs at 6 years old, that it limits their life by half. So they should be able to survive much longer than that. They're not curable, they are contagious, and their production and life limiting. So CL is one that we test for. It causes abscesses inside and outside of the body. Johne's disease is another one, another bacteria. It causes not diarrhea, which is kind of frustrating. It's really hard to detect. It causes extreme weight loss. So it causes diarrhea in cattle, which is like pipe stream diarrhea. It's really kind of impressive. But in sheep and goats, it doesn't cause diarrhea. It causes extreme weight loss with a ravenous appetite. So they're eating, and they cannot absorb the nutrients. So that is how you would, kind of something that might trigger Johne's disease for that one. CAE and OPP are viruses that affect, so CAE affects goats. It's called caprine arthritis encephalitis virus. OPP is ovine progressive pneumonia, affects sheep. Any age can show signs, really. So with CAE, you can see neurologic signs in goat kids. You can see arthritis as they get older. So they get these really big knobby knees. And those are signs that are pretty specific to goats. But in both species, you can get mastitis. It's called hard bag. So it just causes a lot of scar tissue in the bag and they don't produce enough milk. And then it can also cause a pneumonia, which then they call hard lung. And again, is kind of a lot of scar tissue in the lung. And it's almost like panicked, like they just cannot breathe. So it's pretty sad. And those mastitis and pneumonia tend to affect them a bit later on, so 6, 8 years old. And this is typically, these are transmitted through aerosol, but we can control this disease by pasteurizing milk. So it is transmitted through the milk. It's interesting that there's a bit of a difference between OPP. We think it's more aerosol than milk ingestion. Okay, or sore mouth. This is one of the zoonotic ones. You can see that's a person's finger there. These usually affect babies, but if you have a bunch of animals that have never seen this disease, the adults will definitely get it, and it'll cause blisters and scabs around the mouths and their eyes. And then, so it makes it really hard for babies to nurse. And then it also causes scabs on the udder. So moms will kick off babies because it's painful. So you'll see weight loss, death of lambs. Pneumonia is extremely common. The challenge with pneumonia is that the way we identify it is they're struggling to breathe, right? Well, there are other common diseases that can cause animals to breathe pretty fast. So urinary stones, pain, ruminant acidosis. So if they had grain overload, let's say they got into that grain bin, they were not supposed to get in there, but they're a goat and they get out and into everything. We want to make sure those grain bins are nice and locked down. Diarrhea, especially in babies, will cause them to breathe really fast. So making sure we kind of, we want to take rectal temperatures and really know what's going on with those animals, that's where your vet can certainly help. Navel ill is really common in babies that are born in dirty environments and don't have their umbilicus sprayed. We have some parasites are quite common. We talked about wanting to make sure that we prevent those. And then just because we talked about the vaccine, the core vaccine, Clostridia. So enterotoxemia and pulpy kidney disease are caused by that C. perfringens. Those are the top two pictures. You don't really see sick animals, they just die. It is really, really tragic and really preventable. So this is why this is a really important vaccine. Tetanus causes that lockjaw or that sawhorse-like stance. You may just see a third eyelid that won't go down, like in this adult animal down here. Urinary stones, this is a buck in the back, so bucks can block as well. You can see he's vocalizing, he's standing, he's sitting. A lot of people tend to think that they're constipated because they're kind of standing out stretched and really pushing. If they're stretched out, they're trying to pee and they can't. So this is a true emergency. If these guys aren't tended to right away, they can rupture their bladder, which honestly would be best case scenario because they can do surgery to fix those. A ruptured urethra is usually not repairable. And then you can get pretty bad kidney damage with those. And then they can, especially if they had a ruptured bladder, they can die. And then plant toxins are something to consider. So what are the plants that are around your pastures? These are not only affecting castrated males. That was a whole pullover from the last slide. So the most common ones we see here are rhododendrons and azaleas. It's funny, these guys won't really go after these, but if they are clipped and fed to them, they will sure gobble it up. So making sure we're not feeding them garden clippings that are not supposed to have. Goats and sheep love like plum leaves and roses. Oh my gosh, it's like candy for them. So they can have some garden clippings, but making sure that you know what are toxic plants. Puncture vine and goat head are another big one that we see quite a bit. So if you walk around in your pasture and you see these, pull them out. It causes photosensitization or liver damage. So they'll get really easy sunburns and it's pretty painful. All right, I'm gonna stop there. We already talked a bit about vaccines and then I'll let Julie cover records.